This is the moment Geraldine Mason has been waiting for. The 36-year-old mother of three has spent the last month in jail because she fell behind taking her tuberculosis medication. She's never been charged with a crime, and yet she was incarcerated for 32 days, surrounded by women, some convicted of violent offenses.
I was scared, obviously. I didn't just want to go around and because you never know if that person's violent or just not having a good day. I was in my room most of the time, which sucked.
Tuberculosis is a serious illness that mainly affects the lungs. It can be deadly if not treated. The disease is spread through droplets, but can be cured with consistent use of antibiotics. Mason has had it 3 times, and once inadvertently infected family members. Public health officials were concerned if she went without treatment for too long, her disease would become resistant to medication.
I was talking to one of the nurses, and they said, we're not trying to treat you like a criminal. I was like, but I am getting treated like a criminal.
Public health had multiple options. They could order Mason to be sent to a hospital to take her medication. They could put her in isolation elsewhere, or they could send her to jail. They chose incarceration for a woman with no criminal history. Leif Jensen is her public defender.
I think it's important just to recognize what happened here. Manitoba felt it was important for her to take a pill once a day. That's fine. They locked her in a room for 24 hours a day in order to have someone watch her take a pill for 10 seconds a day. That's what happened here. And that was wildly excessive.
Mason lives in God's Lake Narrows and came to Winnipeg for a dentist appointment. On October 27th, she was picked up by Winnipeg police on an order under the Public Health Act and taken to their downtown headquarters where she was strip-searched and placed in a holding cell. She was then transferred to the Remand Centre and strip-searched again and placed in a cell with another inmate. When she had to go to the hospital for an x-ray, she was handcuffed and her feet were shackled. Then she was strip-searched again when she was sent back to remand. A week later, she was sent to the Women's Correctional Centre and strip-searched a 4th time and eventually placed in a cell with 3 other inmates. The Canadian Civil Liberties Association says this case is alarming.
We think that there is no justifiable reason for someone to be detained in a prison for purely public health reasons.
Part of the issue is Mason has to take her medication in front of health officials. She says the pills make her nauseous. So if she has housework or something else to do, she tries to take the pills when she's done. The problem is sometimes it's past 5 p.m. and the nursing station on her First Nation is closed. Mason says she takes the pill anyway, but if health officials don't see her do it, they assume she didn't.
Her lawyer says Mason was not contagious and was never a danger. Health officials should have done more to work with her instead of throwing her in jail.
She was never in segregation. There was never any isolation. She was initially in a cell with a roommate, then she was in a cell with 3 roommates, then she was in a cell with 4 roommates and working in the kitchen.
One of the conditions of Mason's release is that a healthcare worker will FaceTime her every day at 1:30 p.m. to watch her take her meds. Why that wasn't an option before she was incarcerated is unclear.
I was in shackles and handcuffs.
Mason was supposed to be released January 27th, which means she would have had to spend the holidays away from her children and her grandson. But she was released after CBC News requested to interview her in jail. She was reunited with her boyfriend and can't wait to see her kids.
I'm super excited. I can't even wait to get home.
In the month she spent in jail, Mason missed her son's 13th birthday and her grandson's first Halloween. She's so grateful this Christmas, she'll get to spend it at home with her family. Caroline Bargood, CBC News, Winnipeg.